Have you ever worried that you'll be judged for your weight by a medical professional? Or has weight come up in your appointments as being the cause of your health concerns? Maybe you even avoid going to the doctor because you're afraid that they're going to comment on your weight or really pressure you to lose weight in some way. In today's video, we're going to be talking about how weight stigma might be impacting your healthcare and what you can do about it. On this channel, you'll learn all about health at every size, intuitive eating, and the science behind why you overeat and struggle with disordered eating or binge eating. You'll learn tangible take-home strategies that you can use to improve your relationship with food and your body. If this sounds like just what you need, subscribe to the channel and hit the bell in the top right corner so you're notified when I publish a new video. I post a new video every Wednesday. I'm Meredith MacKenzie of Parallel Wellness. I'm a registered clinical counselor and an intuitive eating coach. I've helped hundreds of women who are struggling with poor body image and loss of control with food to find a greater attunement with their bodies, hunger, and fullness cues so that they can go forward to live happy and fulfilling lives. Now, when we think about weight stigma, it's something that happens in everyday life and it's global. It's happening in all situations, but particularly when we think about the medical system and needing to be able to receive care for whatever it is that's going on for you in an unbiased and undiscriminatory way is so important. And I know that there's going to be people watching this video who are going to be critical and nasty, and quite honestly, there's no place for that here. If that's who you are and that's your opinion, keep it to yourself, please. But I want to talk to you today about how you can get the most out of your healthcare and have a better relationship with your primary care physician or other team members on your team so that you're able to get the most for your health and your own personal well-being. Let's break down where some of this weight stigma can be coming in and impacting your experience with healthcare. First, there's the provider that you're going to and their personal attitudes. And this is something that you might have kind of sensed from them. And this is how the research has shown that it does actually, in fact, impact the care that you're receiving. First, primary care providers who have this perception that the person that they're working with is not going to be adherent to the medical protocol that they've put forward tend to take less time and be less client-centered with those individuals. That means that they're less likely to take the time to explain things to you or to ask you for your input or to really try to collaborate with you on a one-to-one level. And in that way, it can feel quite dismissive. The problem is that if a doctor has the perception that their patient is not going to be adherent to the protocol that they're putting forth, then they might actually perceive that person as lazy or not committed, and it can really put them off. And I want to be clear that as I'm saying all these things, that I'm not thinking that all doctors are like this, but there are the handful of doctors that do experience this type of bias and weight stigma, and that this is how it's impacting medical care. Another problem with how weight stigma can really infiltrate that relationship between doctor and patient is that if a doctor experiences weight stigma, they are less likely to have respect for their patient. And this comes across in how they speak, whether they're being warm, if they're being considerate, if they're explaining things in a thoughtful way. And so the communication quality is going to be very different if weight stigma is present. We all know that doctors are busy, but this also pops up when we're considering weight stigma. If weight stigma is present in the relationship with your primary care physician, they might not take as much time with their patients to really explain things, cutting appointments shorter, or not giving them the same quality time that they would to other patients. And in a number of cases, it has been found that the patient has been suffering with very real concerning medical issues, such as cancer, and that their needs have been dismissed by their doctor based on their weight and based on the idea that they just needed to lose weight. And so in these situations when weight stigma is present, a doctor is more likely to dismiss the symptoms that the person is experiencing, to not refer them on for additional assessment or treatment by a different professional, and to not continue to explore what's going on, instead blanketly saying weight loss is the best protocol. And this was demonstrated in a research study with medical students with virtual, not real, fake patients that were presented to them. However, they did show that when a patient presented to them with shortness of breath, if the person was obese, then 54% of the time, they recommended that patient work on fitness and weight loss. On the flip side, if the person was of normal weight, they were more likely to suggest a medication regime. And so even just there, you can see how assumptions were made about the person in a larger body, the reasoning for the symptoms that they were presenting with, and then the treatment protocol that they gave that person. Now, does this sound like anything that you've ever experienced? I know that it can be a really touchy subject, but I would love to hear from you. So comment in the comment section down below if you would like to share your experience. You might also find weight stigma in the environment of the clinic practice that you're attending or in the hospital setting that you're at. Part of this comes from the oversimplification of pamphlets and information that's posted about weight loss, increasing physical movement, decreasing fast food, a lot of assumptions that are just made without actually talking to patients about what it is how they're engaging in certain lifestyle behaviors, and instead blanketly kind of giving this advice as this is how you just do it, this is how you improve. And unfortunately, this approach ignores the complexity of the struggles of weight loss and why people are living in the bodies that they are, and simplifies it down to just calories in and calories out, and makes it seem as though it should be so easy for anyone to pursue these things. And in many cases, regardless of the presenting issue, there are different evaluations that can occur throughout your visit that are more so linked to weight evaluation, whether that's actually physically taking your weight or talking about your dietary intake or your movement, rather than looking at other contributing factors to the possible symptoms that you're experiencing. The actual physical environment and the tools that you access when you're at the doctor can also play a big role. Whether that's the chairs in the waiting room being too narrow to fit their body type, or to the equipment that is like the blood pressure cuffs or the speculum that is being used that is meant for a different size body, that it feels uncomfortable and humiliating because either that equipment is not available for you and it feels as though that you were not considered in that situation, or that it's stored away in some place that is harder to get at and you need to ask for it, and then you feel like you're making a fuss for it. And this is a very uncomfortable experience for anyone who lives in a larger body when they are visiting the doctor for something rather routine. And you can see that the stigma is present because the thought was not given to their needs in that situation. So how does this affect you as a patient? Even just the perception or the awareness that the person is being stigmatized can cause a whole host of emotional experiences. It can be really stressful, as I said, humiliating, and that experience in and of itself can impact your experience of that visit and how you interact with your primary care physician. You might be less likely to ask questions that you need to know the answers to. You might be less likely to engage in the conversation and to really put yourself out there and be present in what you need to talk about with your doctor. And so it impacts the entire quality of that visit and your conversation and ability to communicate with your provider. Research has also shown that if a patient has experienced weight discrimination in the past, that they're more likely to go into future situations with that expectation riding with them, and therefore that can impact any future interactions with medical providers, even if that particular provider is not holding any weight stigma. And so that might impact their ability to be confident and to empower themselves in certain situations when they need to be able to speak up for themselves or to really engage well with their provider. And weight stigma is present in many areas of life, not just in the medical system, but this adds on to it. And research has shown that allostatic load, or that level of stress that a person carries with them, which tends to be higher in people who live in larger bodies due to the amount of discrimination that they're experiencing on a consistent basis. And we know from the research that contributes to a wide range of other medical concerns. And so if anyone's experiencing health concerns already, this added stress, this added stigmatization only makes it worse. There's also the added challenge that if you feel as though you're going to be stigmatized for your weight, or that you're not going to receive equal care to somebody who's in a normal size body or a straight size body, then you're more likely to avoid even going to the doctor. And so that level of avoidance can actually increase the intensity of whatever presenting symptoms you're experiencing, and the disease or whatever's going on for that person is likely to progress without any medical treatment. So when they do eventually go to the doctor, it's much more progressive, it's much more complex and more difficult to treat. And so now you have somebody who is really needing help. They've already been distrustful of the system and distrustful of doctors, and yet they're needing a lot more help, and it's more challenging at that point. And while we know that there are doctors who do hold that weight stigma and are perceiving that their patients are less likely to be adherent to any kind of protocols that they put forward, patients who have experienced stigmatization are more likely to go into those interactions with their doctor with a guard up, in a sense that they are going to be stigmatized against. And so therefore they're more dismissive of the advice that they're given and less likely to adhere. And so it ends up being this negative cycle that really just perpetuates on and on. So we know that weight stigma is there, and we know that it has many challenges that impact both the relationship with the doctor and the patient, but also the patient's overall well-being. And it's something that we need to work on. How can we do this? First, the focus needs to be taken off the individual's weight. Rather than weighing the individual at every single appointment or really focusing on the symptoms that might be linked to their weight, to focus on truly assessing the disease or the presenting symptoms or whatever's going on for that person in a way that is holistic and wide, and focusing more on the health behaviors from a health at every size perspective rather than the outcome, which is the weight. Patient-centered care is also so important. What this means is talking to your patient as though they are another human being, and collaborating and sharing ideas and being engaged in a way that's respectful, but also puts their needs first, and also is respectful of almost like motivating them to do what they need to do to take care of themselves, rather than simply assigning a protocol to them. Medical offices can also go a long way by changing the seating in their waiting rooms to make sure that it's inclusive for people of all sizes, to making sure that they have the instruments and the testing equipment that they need in sizes for all body types, and not keeping it stored and hidden away somewhere that's inaccessible, but rather having it in an area that everybody can use it if it's needed. Clinic space can also have posters or pamphlets or even a mission statement that explains that they are health at every size or an inclusive environment that promotes diversity and respects that people come in different shapes and sizes. And this can be something that can be put up with artwork or even just the literature that's available for patients to access. And finally, having a continuum of care or referral sources that people of different sizes can access to help with the different things that they're going to need help with, whether that means that they're going to need some referrals for more advanced care with their medical needs, or working even with a therapist to be able to address potentially underlying relationships with food and movement, or even just the challenges that come with weight stigma and how that impacts a person's self-esteem and the way they relate to themselves in the world. And having that more integrated approach with your healthcare team would really go a long way to help with bettering some of this weight stigma that exists. Now, if you have enjoyed this topic and you want to know more about health at every size, my student Hazel Jonas has been working on a mini series, which is going to be published in April. And so if you're looking to learn more about that and you're interested in listening, get on the wait list in the description box down below, or have the podcast published at that time, you're going to be able to listen to it down below as well. Now, we've only scratched the surface on health at every size, and we're going to have more videos of this in the coming weeks, but a big focus on my practice is intuitive eating, and it's something we haven't really gotten into in this video, but I did want to share more about my program, One Body to Love, and invite you to book a call with me if you are interested in bettering your relationship with food and your body, and you recognize that you might be emotionally eating or struggling with binge eating. This is where we get to the bottom of this. And so please book a call with me. I'd love to talk to you and see if you are a fit for the program. If you found this video helpful, let me know by giving it a like and subscribing to the channel. I publish new videos every Wednesday. And if you know of somebody who could benefit from learning more about how weight stigma is just so insidious within the healthcare world and what they can do as a provider, or even what they can maybe do to speak up for themselves, send this video to them. I'd love it if you would share it. And I hope that you have a great day.